Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach and the host of the Take Your Life Back Today show. As an addiction recovery coach, I want to share something with you. Let me be crystal clear to leave an everlasting impact upon you. Just imagine being buried alive. You're in a coffin, but you're not dead. You try lifting the lid. The enormous weight upon the lid will prevent you from opening that lid. You then bang on the lid. Hopefully the dirt will unsettle and somebody will start digging their way down towards you. This is what it's like to find yourself at the lowest point of alcohol and drug addiction. You know you have an addiction, you know you need help, you know you can't do it on your own, but you don't know where to turn. In reality, there are probably people standing by your grave. You just don't know that. You just think you're going to die. Usually, though, people don't think about death when they're habitually abusing drugs and alcohol. In order to feed an addiction, you have to be great at repressing the fear of death. I often ask you, my audience, did it ever cross your mind that maybe, just maybe while you were abusing drugs and alcohol, that you would overdose? You would take something away that God gave you called life. And if that's not selfish enough, what about the fact that you're taking your life away from the people that love and count on you most? With this, let me leave one last thought. Don't be like the person that I'm reading about on these index cards that waited and waited and waited until it was too late. Instead, be the person that goes out and gets help by calling me at 844-405-HELP or texting me at 631-599-0218. Take Your Life Back Today show is standing by waiting for you. And so is Larry Geis from the Geis Academy at 516-458-2741. Larry Geis and I always tell folks like you, it doesn't matter where you've been, it doesn't matter where you came from. What matters is that you're here today and you want a better today and a brighter tomorrow. You can find Larry at www.odysseyconsultant.org. Folks, don't forget to put your slippers on. And then take them off at night, and instead of putting them by the edge of your bed, put them under your bed. That way, in the morning, when you get up, you're forced to get on your knees and look under your bed, retrieve those slippers. While you're on your knees, thank God for a home, food, clothing, family. Ask God for guidance and forgiveness and mercy. Folks, I call this knee mail. K-N-E-E mail. Knee mail is when you're on your knees talking to God each and every day. And if you take them off at night and leave them under your bed and you pick them up in the morning and pray to God each and every morning, then you have a time and a place that you do this each and every day. Knee mail. K-N-E-E mail. Knee mail. Folks, once you put your slippers on, stand straight up, roll back your shoulders, stick out your chest, and walk with God 24/7. I have frequently asked questions about bipolar disorder. And, of course, the first question is always going to be, what is bipolar disorder? Bipolar disorder, formerly known as manic depressive illness, is a brain and behavior disorder characterized by severe shifts in a person's mood and energy, making it difficult for the person to function. More than 5.7 million American adults, or 2.6 of our population 18 and over, in any given year have bipolar disorder. The condition typically starts in the late adolescence or early adulthood, although it can show up in children and older adults. People often live with the disorder without having it properly diagnosed or even treated. What are the symptoms of bipolar disorder? Bipolar disorder causes repeated mood swings or episodes that can make someone feel very mania or very low depressive. This cyclic episodes are punctuated by normal moods. Many episode signs and symptoms: increased energy, activity, restlessness, euphoric mood, extreme irritability, poor concentration, racing thoughts, fast talking, jumping between ideas, sleeplessness, heightened sense of self-importance, spending sprees, increased sexual behavior, abuse of drugs such as cocaine, alcohol, and sleeping medications, proactive, intrusive, or aggressive behavior, denial, anything is wrong. Depressive episode signs include sad, anxious, or empty feeling mood, feelings of hopelessness and pessimism, feelings of guilt, worthlessness, and helplessness, loss of interest or pleasure in activities once enjoyed, including sex, decreased energy, fatigue, difficulty concentrating, remembering, or even making decisions, restlessness and irritability, sleeplessness or sleeping too much, change in appetite, unintended weight loss or gain, I should say unintended, bodily symptoms not caused by physical illnesses or injuries, thoughts of death or suicide. How is bipolar disorder diagnosed? Bipolar disorder cannot be diagnosed psychologically by blood test or brain scans. Currently, diagnosis is based on symptoms, cause of illness, and family history. Clinics rule out other medical conditions such as brain tumor, stroke, or other neuropathic illnesses that may include mood disturbance. The different types of bipolar disorder are diagnosed based on pattern and severity of manic depressive episodes. Doctors usually diagnose brain and behavior disorders using guidelines from the Diagnostic and Statistical Manual of Mental Disorders, or DSM. According to the DSM, there are 4 basic types of bipolar disorders. Bipolar disorder 1 disorder is mainly defined as manic or mixed episodes that last at least 7 days, or by manic symptoms that are so severe that the person needs immediate hospital care. Usually, though, the person also has depressive episodes, typically lasting at least 2 weeks. The symptoms of mania or depressive must be major change from the person's normal behavior. Bipolar 2 disorder is defined as a pattern of depressive episodes, shifting back and forth with hypomanic episodes, but not full-blown manic or mixed episodes. Bipolar disorder not otherwise specified, BPNOS, is diagnosed when a person has symptoms of illnesses that do not meet diagnostic criteria for either bipolar 1 or 2. The symptoms may not last long enough, or the person may have too few symptoms to be diagnosed as bipolar 1 or 2. However, the symptoms are clearly out of the person's normal range of behavior. Cyclothymic disorder, or cyclothymia, is a mild form of bipolar disorder. People who have cyclothymia have episodes of hypomania that shifts back and forth with mild depression for at least 2 years. However, the symptoms do not meet the diagnostic requirements for any type of bipolar disorder. Some people may be diagnosed with rapid cycling bipolar disorder. This is when a person has 4 more episodes of major depression, mania, hypomania, or mixed symptoms within a year. How is bipolar treated? While no cure exists for bipolar disorder, it is treatable and manageable with psychotherapy and medications. Mood-stabilizing medications are usually the first choice in medication. Lithium is the most commonly prescribed mood stabilizer. Anticonvulsant medications are usually used to treat seizure disorders and sometimes offer similar mood stabilizing effects that antipsychotics and antidepressants. Bipolar disorder is much better controlled when treatment is continuous. Mood changes can happen even when someone is being treated and should be reported immediately to a doctor. Full-blown episodes may be averted by adjusting the treatment. In addition to medication, psychotherapy provides support, guidance, and education to people with bipolar disorder and their families. Psychotherapeutic interventions increase mood stability, decrease hospitalization, and improve overall functioning. Common techniques include cognitive behavioral therapy, psychoeducation, and family therapy. What is the difference between depression and bipolar disorder? The main difference between bipolar disorder and major clinical depression is the presence of manic episodes. This is why depression alone is not enough to diagnose an individual with bipolar. However, the manic episode meeting DSM-IV criteria is sufficient to make bipolar diagnosis. These were, I think, the 7 most common questions about bipolar. And we need to keep in mind that we cannot confuse bipolar with depression. But I will say this, folks. I'm just scrolling back up here so I could just go over something with you. I will say this, folks. It's very crucial that you understand that part of bipolar is depression also. So that's really important. Bipolar disorder, formerly known as manic depressive illness, is a brain and behavior disorder characterized by severe shifts in a person's mood and energy, making it difficult for a person to function. More than 5.7 million American adults, or 2.6% of our population 18 years or older, in any given year have bipolar disorder. The condition typically starts at the late adolescence or early adulthood. Although it can show up in the children and older adults, it usually is from 18 and up. People often live with the disorder without even having it properly diagnosed or even treated. What are the symptoms? Now listen to these symptoms again. Bipolar disorder causes repeated mood swings or episodes that can make someone feel very high or very low depressive. The cyclic episodes are punctuated by normal moods. Mania episode signs and symptoms include these: increased energy, activity, restlessness, euphoric mood, extreme irritability, poor concentration, racing thoughts, fast talking, jumping between ideas, sleeplessness, and heightened sense of self-importance, spending sprees, increased sexual behavior, abuse of drugs such as cocaine, alcohol, and sleeping medications. So part of bipolar, there is a sense of depression, but there's also usually some sort of usage of drug and alcohol. So if you have a lot of, or any of these signs, please go see your doctor and let him know, let her know what is going on with you. If you need immediate attention, you can always just Google bipolar, and there's usually a hotline, or you can just give me a call at 844-405-HELP, or text me at 631-599-0218, and I'll make sure that I get the information you need. There's nothing wrong if you're alcoholic or addicted to drugs, or you have bipolar. Medication, help from humans here on earth, in conjunction with the help of God, you will learn to live with. You will learn how to live in recovery, just as I do and thousands of other people. Me, as an alcoholic, have learned to live in recovery. Give me a call at 844-405-HELP, and let's take care of your issue, whatever it might be. 844-405-HELP, and may God bless you.